Hello, my name is Tyler Wills. This is my comprehensive final exam, full physical assessment, and this is my fiance, Abigail Griffith. And do I have your consent to do this?
Yes.
Cool. I'm gonna go wash my hands. Scrub it up in the tub. So, Miss Abigail, do you mind telling me your full name and date of birth, please?
Abigail Ray Griffith, 09/01/1989.
Okay, awesome. As I walked in here, I closed all the curtains, shut all the doors. My living room is very big, so it's kind of hard to ensure full privacy. Ms. Griffith, what we're going to be doing is we're going to be doing a full physical comprehensive assessment over everything, head to toe, all body systems. If you have any questions throughout this exam, please stop me. Sound good?
Mm-hmm.
Do you have a question?
No.
Awesome. So, we have full lighting. We're good. I have all my equipment. Sadly, I am not able to obtain vital signs, so those will be verbalized. I will be able to get her pulse and her respiratory rate, but sadly, I'm at home. I ain't got the cool tools. So, Ms. Griffith, can you currently tell me where you are?
Crab Orchard, West Virginia.
Awesome. What are we doing here today?
Comprehensive exam.
Can you tell me what time it is?
10:30. 10:30.
Awesome. So, if you don't mind, look at me real fast. This is my pen light. I'm going to shine this light into your eyes, okay? Just keep your eyes open.
Mm-hmm.
Awesome. Eyes are perla and reactive to light. Ms. Griffith's speech is clear, concise, and her responses are accurate. I find no reason to believe that her mental status is altered or has any issues. If you don't mind, please squeeze my fingers as tight as you can. Good, 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 good. Grip strength, 5 out of 5. If you don't mind, will you look at me and smile? Frowny face. Show me just your teeth. Close your eyes really tight. Open really wide. Good. Kind of scary looking. But if you don't mind, I'm going to look in your nose really fast. Good. Lots of boogers. All right. Open your mouth. Oral mucosa is pink and is moist. Stick your tongue up. Lift up. Let me see under your tongue. Under your tongue. Good? You struggle with that?
Yeah.
All right. I'm going to look at her scalp, everything. No lesions, no rashes. Hair looks good. No dander. Looks well groomed, well kept. From there, I'm going to look at her chest. If you don't mind, will you please sit up straight? Posture is, of course, upright. Patient struggles with no issue. Will you breathe for me just normal, please? Equal rise and fall of the chest, fully symmetrical. If you don't mind, I forgot one thing. Can I look in your eyes, please? Pupils, of course, were reactive to light. Sclera is white and moist, no discharge coming from the eyes. Will you please put your hands out on your knees? I'm going to check your pulses. Pulses are equal bilaterally, 2 plus. Good deal. Same. 2 plus. Pedal pulses. 2 plus. 2 plus bilaterally. And 2 plus bilaterally. No issues there. If you don't mind, just please put your hands out on your knees. Cool. I'm going to check the capillary refill. Patient's capillary refill is 1 to 2 seconds. What I'm going to do now is I'm going to flip my stethoscope over to the bell side, and I'm going to listen to your heart sounds. If you don't mind, sit upright. S1, S2 is audible, no murmur, no gallop, no click. Everything is all good there. Patient's extremities do not show any signs of edema, redness, or swelling. Do you have any issues with your legs? Ever pain in your legs? Numbness, swelling, anything?
No.
Awesome. From there, I will assess the patient's respiratory system. If you don't mind, sit upright for me again. Patient shows no struggle to breathe. Respiratory rate is normal. If you don't mind, just breathe normal for me there. Patient breathed 4 times over 15 seconds, indicating a respiratory rate of 16. I'm going to auscultate her lung sounds. If you don't mind, sit upright for me one more time.
This is last.
Breathe in. Breathe out. 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 Breathe in. Good job. All right, spin for me just a little bit. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. In. Out. In. Out. In. Out. Patient's lobes of the lungs are clear, no wheezing, no crackles, no stridor, no decreased respiratory effort. Everything is all good there. So, from there, what I want you to do you mind to lay down on my table here? I'm going to inspect your abdomen. Means I'm going to roll your shirt up just a little piece. Roll it down just a little bit. Patient's abdomen is flat, non-distended, non-rigid. Everything is all good. So from there, I'm going to listen to your bowel sounds. When was the last time you ate?
Probably 45 minutes ago.
Have you had any issues with your bowels or anything like that?
No.
Awesome. Patient's bowel sounds are normal active, slightly, maybe possibly hyperactive, nothing to be concerned about. One thing I'm going to do is I'm going to palpate the patient's abdomen. If you feel any discomfort anytime through this, I'm going to start out light, get deep afterwards. Just please tell me and I'll stop, okay? Awesome. Any issues?
No.
Any pain, discomfort, anything?
No.
Patient did not experience any pain, no palpable masses, no issues there. You can go ahead and sit up for me if you'd like. Okay, how is your urinary pattern? Do you have any problems? Are you able to go to the restroom frequently, normal? Any issues with urinating on yourself? Any incontinence?
No.
No, nothing other than the casual peeing when you laugh. All right, cool. Patient does not have any issues. If you don't mind, go ahead. What I want you to do, sit right up one more time. All right, I want you to take your chin to your chest, chin to the sky. All right, normal, look at me. Left, right, good, round and round. All right, awesome.
I popped my neck.
You popped. All right, what I want you to do is bring your arms out forward in front of you. All right, in and out, out. All right, roll your hands over. Roll, roll. Cross one arm. Awesome. Good job. Raise one arm up. Awesome. Down. All right, what I need you to do is I need you to bring your right leg up. Good job. No issues with the hip or knee. Left leg up. Good job. No issues there. What I want you to do is I want you to raise that foot up one more time. Reach your feet up. All right. Bend your toes out. Bend them up. Roll your ankle in, out. All right, now roll it in a circle. Good deal. All right, legs down. What I want you to do, put your arms up again. Push me away. Good. Pull me forward. Good. Push my hand down. Good. Push my hand down. Good. Push my hand down. Good. Legs up again. Oh, sorry. Down just a little bit. Push me up. Good deal. Push me away. Good job. And then up again. Pull me to you. Pull me to you. Good deal. Patient has full range of motion. No issues. All joint strength is 5 out of 5. Patient almost pushed me onto the ground. So didn't have any issues there. And no joint immobility. Do you have any issues with your joints? No problems?
Mm-mm.
Awesome. So, muscle strength. Patient is obviously well fit, so she had no issue there. So, do you have any issues with your skin? Any cuts? Anything anywhere?
No.
No abnormal moles? Nothing?
No.
Awesome. What I'm going to do is I'm going to look at your skin. Patient has a couple bruises on her legs. Other than that, no abnormal lesions, cuts, bruises, nothing. Everything looks good. Patient's skin is warm. No, sorry. Cool to the touch. Pink. No issues there. So, from here, this is pretty much the majority of the assessment. And before I leave my patient, obviously, I would like to position them in bed where they're comfortable, put the side rails up as much as I possibly can, keep the patient from falling out of bed, move the call light, aka phone, in reach, so that if they need me, they can holler at me. So, ma'am, I did not find any abnormal findings in this exam. He seemed perfectly healthy. Do you have any overall health concerns that did not mention prior?
No.
Well, I have nothing. Everything came out great. He passed with flying colors. Good job. A+. Good deal. And from there, I will obviously make sure that the bed is low and locked. And that's all I have. I'm going to go perform hand hygiene real fast. It is imperative that you dry your hands on the patient. Imperative. I will, obviously, I'm going to document all my findings in the EHR, and other than that, that's all I have. Thank you again. My name is Tyler Wills, and this has been my comprehensive final nursing assessment. Peace.